Good morning. I am Dr. Ron Ziolkowski, chiropractor in practice in Manitowoc, Wisconsin for just over 30 years. And I had a patient of ours, Alice. Welcome. Thanks for coming on camera with us today. I had Alice come in because the type of problem she had, we're seeing an awful lot of for people in our age group, in our generation. So, Alice, what types of problems were you having that brought you into our office?
Well, during the summer, my knee started to swell. And then after a while, after a few days, there was a lot of pain. And then I couldn't walk on it, I couldn't do all kinds of things. So that was my problem, my knee.
One knee, okay? And I was not the first doctor you started seeing about it, correct?
That's right.
What was your first course of treatment?
I went to an orthopedic surgeon, and he said that the knee had arthritis, and that I should start taking ibuprofen twice a day. And then 5 to 10 years, he thought that the knee would have to be replaced.
Okay. And what types of things was that bad knee preventing you from doing? Besides being painful, did it stop you from doing certain things?
Oh, definitely. I couldn't bike, I couldn't run. Steps were extremely painful. And even walking was very hard.
Now let's talk about those steps, because the home you live in has many levels in, and you were telling me that was, how did you have to go up and down the steps? Why don't you explain that to me?
I had to go up and down one step at a time with keeping my left leg straight. So it took a long time. We actually have 29 steps from the bottom to the top.
Okay, so you came to our office, we evaluated it, we started working on it. What's happened since then?
Oh, it's perfect. It's just I'm taking the steps 2 at a time, and no problems anymore. I'm sure I can bike ride when spring comes.
Mm-hmm.
So.
How long did it take before you started noticing significant improvement? Do you remember?
Well, I came to you at the end of September, and I think by November things were better. And I know for sure by the middle of December I was taking those steps.
Mm-hmm. And you said you have 29 steps, and I remember the first time you came in and said, hey, I went from the top to the bottom,
Yes.
no problem, no pain,
Yes.
and the big smile on your face. If you remember,
good.
when I evaluated that initially, I said, your knee is not that bad. We took care of a lot of knees in the 30 years we've been in practice, and you can tell when a joint is kind of on its last leg and quite wearing out, and yours had some wear and tear, but I didn't think yours was nearly that point. So besides the pain being gone, besides being able to go up and down steps, how is your freedom of movement in everyday life, like with walking and the other things?
A lot better. I've had trouble with sciatic nerve on both sides, left and right, and that seems to have dissipated a lot. And then other things. I just overall feel healthier. I move better. Getting out of bed in the morning isn't such a big deal anymore. So, and I'm sure a lot of that has to do with chiropractic. Otherwise, I've changed nothing in my life besides that. Yes.
Okay, so what parting thoughts do you have for us in terms of would you recommend? What would you say to someone who's looking at joint replacement? That's been the medical diagnosis. What would you tell them?
I would definitely try a chiropractor before I would try a medical doctor. It won't hurt, and if it helps, that's wonderful, and I definitely would recommend it.
Okay, let me jump in. You mentioned something. You said it won't hurt. Tell me, when we work on your knee, is it painful?
No. It, initially it was, but the knee was swollen, and I had been walking on it for a few months before I came to you. So, of course, in the beginning it was a little bit, it did hurt a little bit when you touched it. But, no, it doesn't hurt to go to a chiropractor.
Okay, great. So, again, parting thoughts, you said try a chiropractor before you consider joint replacement, correct?
Right. Yes, definitely.
Okay.
I would say that.
Well, Alice, thank you for being on today. So, good day, folks.
You're welcome.